Urology Unplugged. I'm your host Dr. Vaishali Goswami, and today we have special guest Dr. Ketan Vartak sir. He is a renowned urologist from Pune, India. Dr. Vartak has been treating patients with urological disorder for over 26 years, and we are thrilled to have him here to share his expertise on common conditions of many men, benign prostate hyperplasia or BPH. Thank you for joining us, Dr. Vartak.
Thank you. First of all, it's a great pleasure to be here to connect with the common man, because we come across a lot of patients daily. Their problems are different and common man's problems are different. So whenever we connect to common man, it is easier to detect the patient at the early stage, and they also get benefited because they are not aware of common problems in their life. It's always better that way. Thank you.
So let's start with the basics, sir. What is exactly BPH and what is difference between prostate cancer and BPH?
Prostate happens only in males. I mean, there's an organ present only in males. The females don't have prostate. So whenever with age, the hormonal changes occur in the body. So because of the hormonal changes, the prostate starts enlarging.
Okay.
Now, because of some genetic problems, instead of benign enlargement of the prostate, some genetic transformation happens and the cells convert into the malignancy or cancerous cells.
Okay.
So whenever the growth happens because of cancer, it is called as cancer prostate, and whenever it is benign, it is called benign prostatic hyperplasia. So both are age-related problems.
Okay. So what causes the prostate to enlarge in BPH?
It's all age-related phenomenon, because with age the testosterone levels drop, and because of the testosterone levels, the prostatic cells, they keep on getting multiplied more and more, and that's why the prostatic size increases.
Okay.
So the prostate gland is like an apple. So there is a way in between the two lobes of the apple, and the seeds are in between, right?
Okay,
So similarly, the urethra or urinary passage is in between the two lobes of the prostate. Whenever the prostate starts enlarging, it keeps on compressing the urethra, and that causes the obstruction of the urethra. So it all hypertrophy or the enlargement of the prostate happens because of the age, and with age, because of the hormonal imbalance, the prostate starts enlarging. That is called as a BPH or benign prostatic hyperplasia. Hyperplasia means increase in the size.
Yes. And who is more likely to develop the BPH?
See, BPH is common across all different caste, creeds and everything. There is no socio-economical or any differentiation between the BPH of some other socio-economic status with other status.
Okay.
It's common all across the world, and with age only it keeps on enlarging. There is no difference.
Okay. So, and what are the common symptoms of this BPH?
BPH symptoms are mainly clubbed together as LUTs or LUTs, that is called as lower urinary tract symptoms. So, main symptoms are the one person has to go frequently for urination, that is called the frequency. He has the urge to pass urine, there is urgency.
Is it time related?
Yeah, every say 2 hourly or 1 hourly they have to pass urine. Third is nocturia. That means they have to get up in the night. So I'll say at the age of 55-60 or more than that, people are used to get up in the night for urination. But if it is more than 2 or 3 times in the night, on every night, then it is a problem. So that is called as nocturia. And third is the hesitancy. Whenever a person goes for urination, he almost starts the urination immediately. But in hesitancy, what happens? He has to wait for a long time for initiation of urination. That is called as hesitancy. Then there is thin stream, when the flow of urine is getting obstructed. So whenever the person passes the urine within say 30 to 40 seconds, normal bladder volume is approximately 400 cc or half a liter. So 30 to 40 seconds one finishes the urine normally in young age. But with advanced age, the time for urination keeps on lengthening. So what happens is he takes almost a minute or minute and a half to complete the urination. So that means the time to void is longer as compared to the younger age. So that is called the obstructive void. The stream is so low that he has to strain for urination. So one more symptom is straining for urination. So whenever a person urinates, he has to strain again and again to pass urine. So these are all different symptoms. So one group is the urgency, frequency, nocturia, urgency. All are irritative symptoms.
Yes.
And obstructive symptoms are thin stream staining, incomplete evacuation.
Okay.
So whenever patient passes urine, after he passes urine, after a few seconds he feels that he is not passed fully and he has to pass it again. So if you do a sonography, it will suggest that he is not passed the urine fully. So that is called the incomplete evacuation.
Okay.
So these are all common symptoms of BPH. Unfortunately, the problem is the symptoms of BPH and symptoms of CA prostate or cancer prostate are not different. So that is the main problem in detecting the cancer.
Okay. Sir, how does BPH affects man's life?
See, the problem is if a person is traveling and he has to pass urine every now and then he has a lot of problems because the driver will not stop frequently. If he's traveling by train or plane, that's a different story. But otherwise, they get severe urgency. And the problem is whenever they get severe urgency, they cannot control the urination.
Oh.
And whenever they cannot control the urination, they keep on passing urine in their pants. And that is a big headache for them. So urgency frequency is a big problem. Second, what happens is if the obstructive symptoms are severe and they cannot pass urine in time, then there is more likelihood that they will go into retention of urine. So their urine gets totally obstructed and they have to be catheterized earlier. So these are the common problems that one can face every now and then.
And what are the diagnosis stages for this?
The commonest test is they have to consult a nearby urologist first. The urologist will assess whether the prostate is obstructing or not, or he has only irritative symptoms. In case he has only irritative symptoms, probably the urologist will give them only a medicine. In case they have obstructive symptoms, they will get a sonography done first. And the sonography is typically called as a pre and post void sonography. That means the sonography is done in the beginning with the bladder full. And once the patient passes urine, again the sonography is done to check whether he has passed the urine fully or not. Okay. So that is the typical first sonography. The second is the blood test called as a PSA or prostate specific antigen.
Okay. Yes.
Now prostate specific antigen is a test, it's a blood test. It's a prostate specific antigen, it's not a cancer specific antigen. So it is not necessary that high PSA more than 4 means cancer. So high PSA can be because of cancer, it can be because of infection, it can be because of some trauma or some instrumentation or anything like that. So not necessarily the PSA means cancer. Because many patients keep coming in a panic that I have high PSA and there's a likelihood of cancer. So you don't have to worry. Only thing is if the PSA is high, you have to be investigated thoroughly and you have to rule out the cancer at the earliest. So that precaution you have to take. And the last is called as per rectal examination. Whenever urologist checks it through the rectum, the prostate gland is very, very superficial to the rectum. So once he puts his finger through the rectum, he can palpate the prostate or feel the prostate anatomy. And he can judge whether it is a benign prostate or a cancer prostate and how much it is. So these are the common tests which are routinely done.
And sir, as we all know that you are a pioneer of tulip laser technique, so can you please tell what it is exactly?
See, prostate operation in say 80s and 90s was done by open surgery. There used to be a large cut here, and the bladder used to be opened, and by a finger we used to detach the prostate from the surrounding, and the complication rate, bleeding, incontinence rate was too much. So that got replaced with the common technique which is called the TURP, that is called the transurethral resection of prostate, where endoscope is passed through the urethra and the prostate is removed piecemeal by pieces. And the machine used is called the electropotter, which is based on the electrical current. In around 2000 and 2010, between those times, lasers came into being. And the first laser which started prostatic operation was holmium laser. The problem of holmium laser was it was a pulse laser, so it used to dissect the prostate. Then in around 2005 or 6, the new laser came into organ that is called the thulium laser. So I was pioneer in getting the first 120 watt thulium laser in India. And the best possible technique for thulium laser is called as the thulium laser enucleation of prostate. See, the prostate has two parts mainly. One is called as the adenoma, which is the enlarged part of the prostate, and the other part is the capsule of the prostate. So there is a plane between the adenoma and the capsule. So in the open surgeries previously or in large glands even today, what we do is we with the finger we dissect the plane between the adenoma and the capsule, and the adenoma is separated.
Yeah.
The same technique which is done by open technique by finger is done by laser in endoscopy. So you don't have to cut open the abdomen or anything like that. You pass the endoscope to the urethra and you enter into that place.
Okay.
Now it is a laser which has the advantage of all the possible dream scenarios that a surgeon wants. So while cutting he doesn't want bleeding. While cutting he wants the perfect cutting.
Yes.
So all these parameters are available with thulium laser. The thulium laser, whenever we cut, the 90% of the blood vessels are taken care of at the time of cut itself. So normally if you cut with a knife, there will be thousands of blood vessels and the whole thing will be bloody. In laser, once you start cutting, 90% of blood vessels are taken care of. So they don't bleed at all. Now rest of the 15% blood vessels which bleed, they are coagulated immediately and the blood stops. Okay. So whenever we are dissecting, so 90% of blood we don't come across. So that dissection becomes very easy. And it's a continuous wave laser where it acts like a pottery and it has all the advantages of laser.
Okay.
Plus it has the advantage that whenever a tissue comes in between where I cannot dissect, I can just vaporize it.
Oh.
That means it becomes vapor, the tissue becomes like a vapor. So all these advantages were available with thulium laser. The only problem of thulium laser was it was a costly machine and it was used only for prostate.
Okay.
Thulium laser can be used for prostate, stones, strictures, everything.
Okay.
So people were very used to or comfortable using the thulium laser. Thulium laser there were not many takers. So I was the first one to start thulium laser in India in 2009.
Really great. So what are the treatment options for BPH?
See, right from just a modification of drinking less water or something like that will help in urgency frequency. In case the prostate is obstructing, the second line of therapy is the drugs. So there are very good drugs available. These are mainly called as alpha blockers. So what alpha blocker does is the prostate has two parts as I said earlier. The adenoma, which is the enlarged part, and the capsule, which is the fibrous part. Now both the components are there. The static component, which is the enlargement of the adenoma, which is compressing the urethra by volume, and the capsule gets hypertrophic or enlarged inside, which gives us pressure on the urethra. Okay. So the alpha blocker and the medicine which is called the glucosteroid, what they do is glucosteroid will reduce the volume of the prostate by 10, 15, 20%. And alpha blocker will soften the capsule a little bit. The tension of the capsule will be reduced. So once the capsule gets relaxed, the prostatic urethra gets opened. Urinary passage gets opened up. And that's how it helps the passing in. Okay. Now along with this, as I said earlier, urgency, frequency, nocturia, urge incontinence, all these symptoms are there. For those, only relieving the obstruction is not going to help. So for them, the other group of drugs is called the anticholinergic, where the bladder is overactive in all these drugs. So overactive bladder means what? If the bladder volume normally is 400 to 500 ml. So when the person accumulates 400 500 ml urine, he gets severe urge to pass it. So between say 350 to 500 ml, he gets only the urgency, but it doesn't become out of his control. Okay. In overactive bladder, what happens is that instead of 350 or 400 ml, he starts getting that sensation at 100 or 150. And after 150 or 200, he cannot control urine anymore. So that becomes urgency, and then sometimes they keep on passing urine by incontinence. It's called the urgency incontinence. So all these symptoms are related to the bladder hypertrophy or overactive bladder. So all these can be tackled by medicine which is called the anticholinergic group of drugs. So solifenacin and all those group of drugs, these are helpful in relieving the symptoms of urgency. So all these therapies are easily available and they are not very expensive drugs. And they help to save, I would say 70-80% of the patients are helped by all these medicines. Okay. Only follow-up is required by doing a sonography, and the second I forgot to take is uroflowmetry. That is the flow of urine. So by doing the sonography, uroflowmetry, PSA, and routine visits to urologist, all these symptoms can be solved by medicine. The third step is the minimally invasive newer techniques of prostatic treatment. The common or the newest kid on the block is called as a resume, RESUME.
Resume.
So what it does is we pass the endoscope through the urethra and it has a needle which produces steam under pressure.
Oh.
Okay, so once that prosthetic lobe is there, so endoscopically that needle goes into the lobe and the machine creates steam under pressure. So that steam is infiltrated into the prostate.
Okay.
Now when the steam gets, because of the pressure, it keeps on spreading into the prostatic capsule and adenoma and it will necrose or it will hamper the blood supply and the tissue will be necrosed or killed. Okay. So once the prostate is necrosed, the capsule will start opening. So these are the newer techniques, but the problem is you have to be on catheter for 5 to 7 days.
Okay.
And there is no guarantee that it is not going to happen. Okay. The second thing is called as the Eurolift, where kind of chain or spring is loaded into the prostate urethra. So what happens is that spring is, once it is injected, it automatically gets compressed. So the prostatic lobe gets compressed because of the spring and the prostatic urethra gets open. Okay. So all these are newer techniques. And third is the prostatic stent, where only a stent is put into the prostatic urethra that will keep the lobes apart.
Okay.
And the next step is operation. Now operation, if the gland is very very large, more than say 250-300 grams, then only open surgery is done these days. Otherwise open surgery is almost outdated for prostate. Common surgery is TURP, which is transurethral resection of prostate, where you using the cautery you cut the prostate into multiple pieces and take them out.
Okay.
And last is laser. Now laser, commonest laser nowadays available are chromium laser and thulium laser. And the newer laser is thulium fiber laser, which is almost like a replica of thulium laser. So these are the no, not costlier. It is little. It can be used for stones as well as prostate.
Okay.
So it has advantages of multiple utilities.
Okay.
So these are the common therapies that are available.
Okay. So what kind of lifestyle changes you suggest to get easier along with that BPH symptoms?
As I said, first and foremost is if one has nocturia and severe frequency urgency, he has to reduce his water intake, especially in the nights. Okay. So normally what I advise patients is if they are sleeping at say around 10:30, so they have to have dinner at 7. Okay. So keep a gap of minimum 3 to 3.5 hours in between. So during dinner, whatever quantity of water he wants to have, he can have. Okay. After dinner, he doesn't have any water. And in between nights, whenever he gets for urination, many people have the habit of drinking water again. Yes. So if he drinks 200-300 ml of water again, then he has to get up after 2 to 3 hours again for urination. Yes. Because that water is going to go into urination. So stop drinking water after urine. Okay. In case one is really thirsty, he can just sip 1 or 2 sips of water. That's all. So once the water intake is reduced, obviously the urine output is reduced, and then the nocturia will be taken care. The medicine will help, but these lifestyle changes will definitely help the patient. So nocturia in males as well as females, this can be this technique can be very useful. Secondly, the most important thing is during travel, especially. One has to be very careful to pass urine every now and then. So if he doesn't get time for urination and he keeps on prolonging urination, there are very high risk of going into urinary retention. Oh. So that care has to be taken. And then once he has urgency, frequency, all those symptoms, he can start medicines early. So that all the complications like retention of urine, chronic retention, bladder dysfunction, all the complications can be avoided.
Okay. So can BPH be prevented?
Not really, because as I said, it is an age-related phenomenon and the hormonal changes in the body you cannot prevent. So BPH cannot be prevented. But as I said, if you pick the problem earlier, it can be kept under control. So you start the medicine early. If you go into retention of urine and the prostate is enlarged too much, then it goes out of hand. But in case you detect it early and start treatment early, then probably you can keep it under control. Okay. So that's the only thing in your hands. You cannot prevent the age. You cannot prevent. Okay. So like joint pain and the cataract, all these things are age related. Similarly, BPH is age related. Okay. You cannot prevent it.
So before we wrap up, let's discuss about the myths about prostate. Sir, does it cause because of excessive sexual activity?
There are very common myths in any urinary tract problems, and especially prostate. It is not related to the sexual inactivity or activity. Many people blame it for higher sexual activity in their younger age, but that is not true at all. It is not related to sexual activity. In fact, with advancing ages, the sexual activity reduces, and it is indirectly related to your testosterone level dropping. So ultimately, it is age-related hormonal changes which leads to age-related less sexual activity and at the same time prostatic enlargement and also. So the more sexual activity is definitely not related to BPH. In case there are many not published reports or proven reports, but many authors have suggested that more sexual activity, especially in older age group, will at least prolong the time taken for BPH because of the taken care of the hormonal inability during the sexual activity.
So other than the main thing is that is it contagious?
Not at all. It's not a contagious disease. There is no bacteria, virus, or any organism which causes prostate. It is purely age-related symptom. See, the age-related problems in males and females are almost similar. In females, what happens is the urethra starts contracting because of the menopause. Menopause, the blood supply to the vagina gets reduced. Because of the blood supply getting reduced, the epithelium gets atrophied and the urethra starts shrinking. So they also get similar problems as like BPH. So like females, males also have BPH, and both are not contagious. Both are not transmitted to any younger generation, kids, nothing like that. Not at all.
Okay. One more main thing is that it requires surgery.
As I said earlier, 70 to 80% patients are treated by medicines, and there are very good medicines available today. They can take care of your obstruction, they can take care of your urgency frequency symptoms. And whenever the medicines are not helping, or medicines are not sufficient for the patient to pass urine completely, or the symptoms are not getting solved at all, or he is getting some problems associated with BPH like infection, stone formation, bladder dysfunction, all those things. In case that scenario happens, then only surgery is needed. Otherwise, if the patient is happy with medicines and uroplometry is good, his sonography is not suggesting any residual urine, there is no need of any surgery. So if you take 100 patients of BPH, only say 15-20% need surgery or some kind of intervention. 80% or above patients need only the medical therapy.
One more thing is that it happens with only old age patients. Old age.
As I said, again, it is age-related hormonal problem which causes BPH, so it has to be age-related. But sometimes what happens is because of some genetical problems, the prostatic enlargement happens early. So they present at the age of say 50, 55 also. And nowadays it is becoming more and more common. I don't know why, but it is commoner to detect patients at the age of 50 or 55. Maybe they get investigated early and they get detected early. So that's why these patients have large prostate at the age of even 50 or 55. And they need some kind of surgery.
So one more myth is that does BPH leads to prostate cancer?
Not at all. These are two different scenarios, but unfortunately both are age related. So the patient starts with BPH because it starts at the age of 40-45, and with age some cells turn malignant or cancer. So BPH and cancer are not related, but both are age related, both are hormone dependent. So it is the cell doubling which gives rise to BPH. It is the more cell doubling which gives rise to cancer. So it is all age related and hormone related, but they are not connected with it.
Okay. Thank you, Dr. Vartak, for providing such a valuable insight on BPH. It's clear that understanding this condition and seeking early treatment is crucial for maintaining prostate health and quality of life. If you want to consult Dr. Vartak sir, he is available at Pramodini Urology Foundation, Ferguson College Road and Ratna Memorial Hospital, Senapati Bapat Road, Pune. So that's all the time we have for today. Join us next time as we have to dive deeper into the causes, diagnosis and treatment of BPH. Until then, stay tuned to Urology Unplugged for more insights on men's health. Thank you.